Hello, everyone. Thank you for SAGES and the moderators for allowing us to present our work here today. For disclosures, Dr. Lenikov is a stockholder of Virtual Incision Compilation. It is a common knowledge that there has been an increase in the minimally invasive procedures over time, and several studies have shown that the benefits of minimally invasive surgery over its open counterpart, with decreased length of stay and better overall complications and decreased mortality as well. Still, several studies have analyzed the tendencies in the fields of urology and OBGYN. However, little data is available for what is happening in the general surgical field. That is why we wanted to evaluate the current national trends for robotic-assisted utilization in the general surgical field and to account for the proportion of open, laparoscopic, and robotic-assisted procedures. We also performed a cost analysis of our data. For that, we looked at the VZN database from October 2008 to October 2015 using ICD-9 procedure codes for common procedures including colectomy, cholecystectomies, ventral and inguinal hernia repairs, and bariatric surgeries. For bariatrics, we included sleeve gastrectomy, Roux-en-Y gastric bypass, and gastric band. We looked at the procedures utilization within quarters of years and for the overall direct cost for all the 7 years combined, using linear-bilinear association tests for trends analysis and non-parametric tests for cost evaluation. We had a total of more than 850,000 patients, including this study, and this table shows the distribution of approach within each procedure for all of the 7 years combined. As you can see, both colectomies and inguinal and ventral hernia repairs was mostly predominantly performed using an open approach, whereas cholecystectomies and bariatric surgeries were performed in a laparoscopic fashion. Still, robotic-assisted procedures have had very few utilization rates for all of the procedures that were studied. Those graphs show the trends in utilization by approach for each individual procedure evaluated, starting in the last quarter of 2008 in blue, going up to the last quarter of 2015 in red. And as you can see, there was an overall increase in minimally invasive utilization for all of the procedures evaluated. So for colectomies, we saw a decrease in 10% in the open utilization versus an increase in both laparoscopic and robotic-assisted surgeries. For cholecystectomies, there was a similar trend observed with a decrease in open procedures and an increase in laparoscopy. Still, robotic was very few performed robotic was very few performed in the cholecystectomy field. For bariatrics, though, laparoscopy was by far the predominant approach, and there was a similar growth between laparoscopy and robotic utilization, which increased an average of 5% each. For inguinal hernia repairs, though, there was a different trend that we observed. Open procedures seemed to be steady over time, whereas there was a significant decrease in laparoscopy versus a significant increase in the robotic assistance. So this data supports our hypothesis that probably laparoscopic surgeons are now switching to a robotic approach. Also for ventral hernia repairs, there was a significant decrease in the laparoscopic approach with a significant increase in both open and robotic procedures, which may be probably due to a better and improved patient selection and increase in utilization of robotic. This graph shows the trends in utilization for minimally invasive procedures only, both lab in blue and robotic-assisted in red, for all of the procedures combined within quarters. So we can see that despite there was an overall increase in the absolute number of minimally invasive surgeries performed over time, there was a significant increase disproportionately seen in robotic compared to the laparoscopic approach. And our cost analysis also showed that open procedures were the most expensive, followed by the robotic-assisted ones, and laparoscopic, which was the less expensive. So in conclusion, our data shows that there was a significant increase in minimally invasive utilization over time, and that robotic increased disproportionately compared to the laparoscopic counterpart. And although we cannot prove where those patients are coming from, we believe that especially for inguinal and ventral hernia repairs, they are coming from laparoscopic surgeons who are now adopting robotic techniques and not from open who are switching to the robotic approach. Thank you.